So welcome and thank you for joining me in this lesson on the link between depression and chronic pain. This lesson focuses on understanding how these two conditions interact, exploring the biological mechanisms underlying their connection, and discussing effective treatments. Chronic pain and depression are often viewed as separate conditions, but research reveals they share a deeply intertwined relationship. This connection is not just behavioral or emotional. It also has roots in neurobiology and brain function, as we will see throughout this presentation. By the end of this lesson, you will better understand why treating both conditions together is critical and how emerging therapeutic strategies can improve outcomes. So let's dive in. The relationship between chronic pain and depression. The association, the link is a dual burden. And chronic pain and depression are not just co-occurring conditions. They are also deeply interconnected. Chronic pain can take a heavy toll on both the body and mind, leading to emotional distress like anxiety and sadness, as well as physical symptoms such as stiffness, fatigue, and low energy. What makes this relationship so challenging is the feedback loop that it also creates. Chronic pain increases stress and emotional strain, which can worsen depressive symptoms. In turn, depression can amplify the perception of pain, making it feel more intense and harder to manage. Understanding and breaking the cycle is critical to improving the quality of life for individuals affected by both conditions. So let's talk about some studies out there on the topic of pain and depression. In a study by Mullins et al. In 2023, it was found that adults with chronic pain had elevated severity of depressive and anxiety symptoms and were more likely to take medication for depression and anxiety. The presence of chronic pain in adults associated with significantly higher severity scores for both anxiety and depression as measured by validated surveys in a national representative sample. The same is true for the association between chronic pain and an adult taking medication for depression and anxiety. This data highlight the impact chronic pain has on psychological well-being within the general population, and that's just the general population. In medical news today, in 2023, in an article reviewed by Dr. Olele and written by Dr. Lavaron, it was found that up to 85% of people with chronic pain experience severe depression. Moreover, chronic pain can increase levels of stress and contribute to a lack of sleep, resulting in low moods. Chronic pain can induce stress, feelings of tenseness, anxiety, irritation, and agitation, which can result in symptoms of depression. The American Psychiatric Association says that those living with chronic pain have a heightened risk of developing mental health issues such as depression. This article examines whether chronic pain can lead to depression, including how it often occurs in a cycle. Chronic pain can cause stiffness, soreness, and other painful symptoms, which last for several months. This stress and anxiety that occurs when having to deal with chronic pain can result in symptoms of depression. So let's talk about the neural mechanisms of pain and depression, the brain's role in this condition. The biological mechanisms connecting chronic pain and depression. So let's talk about some research in this area. Research by Mokhtari et al. In 2019 identify key brain regions that play a role in this connection, including the hippocampus, thalamus, and prefrontal cortex. In individuals with both chronic pain and depression, the hippocampus shows reduced neurogenesis, the process by which new neurons are formed. This leads to decreased brain plasticity, which may explain why depressive symptoms persist and worsen over time. Neurotransmitters like serotonin and dopamine also play a critical role. Deficiencies in these chemicals are associated with heightened sensitivity to pain and a lower ability to regulate mood. Finally, neuroinflammation, the activation of immune responses in the brain, has been shown to amplify both pain and depressive symptoms. Together, these factors create a perfect storm that links the two conditions at a biological level. Yet in another study by Shen et al. In 2017, it was also found that chronic pain and depression often coexist and exacerbate each other. There are considerable overlaps between pain and depression-induced neuroplasticity changes and neurobiological mechanism changes, and individualized application strategies for drugs and antidepressants may be effective in treating chronic pain-induced depression. So why don't we talk now about some effective treatments for managing chronic pain and depression? Managing chronic pain and depression requires a comprehensive, multidisciplinary approach. Pharmacological treatments, of course, remain a cornerstone with medications such as tricyclic antidepressants and monoamine oxidase inhibitors showing promise in treating comorbid conditions. Additionally, targeting neuroinflammation through specialized drugs could provide relief for many patients. And non-pharmacological treatments are equally important, like the one we are discussing in this course, cognitive behavioral therapy, or CBT, which has been shown to improve both mood and pain-related function. This type of therapy helps patients reframe negative thought patterns, reducing the emotional toll of pain. Another thing that also helps is physical activity, which is another powerful tool. Regular exercise promotes neurogenesis, the growth of new neurons, and reduces inflammation, benefiting both the body and mind. So why don't we do now some engagement and some reflection on your own? Chronic pain and depression are complex conditions, and supporting those affected requires a team effort. What do you think what strategies can healthcare providers, caregivers, and communities implement to improve support? Some areas to consider include identifying the early signs of the pain-depression cycle, encouraging multidisciplinary care approaches, and advocating for greater access to therapies like cognitive behavioral therapy. Your thoughts and ideas are valuable as we work toward better solutions. Now, in the following presentation, we will discuss the prevalence of chronic pain and depression and how different factors intersect with the prevalence and access to healthcare. Thank you.